Today I've been looking at Listeria monocytogenes, a weekly gram-positive bacillus that causes what is known as listeriosis, a condition that is very depressing to the pediatrician. The pediatrician looks at this and says, "Oh, how do I start when the target population is the weakest of them all?" I mean, look, what is being targeted here is the fetus. Is there any resistance to the fetus? No. What is targeted here is a neonate. A neonate is that baby who just lives for something like 1, 2, 3 weeks. That's a neonate. And that one is being targeted because it gets infected through an infected birth canal, infected with this Listeria monocytogenes bacillus. This is terrible. And what is the fate of this infection? If a fetus is being infected whilst in the uterus, I mean, if the mother is actually infected with Listeria monocytogenes, and there's a birth canal that's actually infected full of this Listeria monocytogenes. So when the baby gets through, the baby is going to be infected. In fact, the baby can even get infected in intrauterine. Intrauterine, if there's intrauterine infection, that's the worst. Because now the fate of that fetus is that they will be able, is abortion. That's the fate. The fate is premature delivery. That's the fate. The fate of this fetus is stillborn. Stillbirth. Stillbirth. That is the fate. So this is the worst thing that can happen to it. The pediatrician just gets depressed. I mean, the obstetrician, the one who's delivering this, gets depressed. What is all this? What is all this? It's because of Listeria monocytogenes. When it comes to adults, it targets the immunocompromised. I'm passionate about treating my immunocompromised patients, because HIV patients, they get immunocompromised because of the HIV itself. And when now they are targeted by this bacillus, this Listeria monocytogenes, this becomes a problem. This becomes a problem. I mean, these are defenseless because they are immunocompromised because of one condition, which is HIV. And others, they get immunocompromised not because of HIV, they get immunocompromised because of diabetes. Others, they get immunocompromised because of cancer therapy. The chemotherapy and all that, it immunocompromises the patient. And so now, if the patient is unfortunately infected with Listeria monocytogenes, that is a problem. It is such a mess. Because now you tell me, what do you see? If, for instance, the patient gets the infection through the placental infection, two things will happen. There'll be neonatal death. Neonatal death, that's for sure. Number two, what's going to happen is there's a condition where the organs just develop abscesses. And it's called, and the organs of the fetus, of the infant, or of the infant, they develop abscesses. Talking about an eye that has got abscesses, we talk about an ear that has got abscesses, nose has got abscesses. All the organs in general, you can think of any organ, they get abscesses. This condition is known as granulomatosis. Granulomatosis infantica septica infantiseptica, granulomatosis infantiseptica. And all you know that if an infant has got that, then that infant is going to be prone to infection, to abscesses in the organs. The organs will have abscesses. And this is terrible. And you ask yourself, what am I going to do to try and treat this? Sometimes these patients, number one, they don't end up there. They end up developing a meningitis. They develop a meningitis. The meningitis has got to be treated somehow. I'm thinking of a neonate who has to be treated for meningitis. How do you see that the neonate has got a meningitis? They have a bulging fontanelle. They've got a very tense fontanelle. In addition to the lethargy that you see, they don't have any energy. You know, they are lethargic. They don't have any energy. And these children need these are infants. These are to be treated. What do we do? There are only two drugs which are capable of crossing the blood-brain barrier to be able to reach the Listeria monocytogenes. To be able to reach it, you need ampicillin and you need penicillin G. And that's what you need that is what you need to be able to do this. And this is a mess, really. And what kind of drugs are you going to use? With the adults, the mother, for instance, who is, they normally develop a fever, the mothers who are infected with this. They normally develop a fever. They normally develop a back pain. And in addition to that, they get this intrauterine infection. That intrauterine infection, which gives a sentence to the fetus that you abortion. You, the fetus, you've got premature delivery. You, the fetus, you've got stillbirth. It's actually a sentence if there's severe intrauterine infection. And so, what then? How are you going to treat these patients? You're going to use chloramphenicol. You're going to use tetracycline. You're going to use ampicillin. And you're going to use cotrimazole. And of course, if you're treating the meningitis, make sure that you know that the combination of ampicillin and Pen-G, because they're capable of crossing the blood-brain barrier, and they'll be able to treat the meningitis there. And that's what you check out. So if you are treating still the mother, still you need to make sure that you give ampicillin. But in addition to ampicillin, give gentamicin as an aminoglycoside. Give that. It tends to make it more effective. And then if you go on to treat this, you've got to make sure that if you would give chloramphenicol, tetracycline, and you give your ampicillin, or you decide, no, I'm going to use cotrimoxazole. In other words, I'm going to use my Bactrim. That's important to understand, that you are going to use either Bactrim or chloramphenicol, tetracycline, and ampicillin. So that's how you treat these patients. And understand that it is crucially important to see that the mothers are treated with antibiotics to make sure that you combat the infection of the fetus. To combat the infection of the fetus. That's why you have to do, really have to treat, go out of your way and treat this. Thank you very much. And when you want to get a thorough explanation of this, go to my YouTube channel. My YouTube channel, that's where everything is explained properly. How this Listeria monocytogenes, how it is transmitted, and what is it that we need to do. What that we need to do to combat it. Though it's difficult, but please do something about that.